Hello my juniors, welcome to another anatomy lecture series today. It's your great science tutor Lorenzo, and today we'll be dissecting and breaking down the anatomy of the mammary gland, which we call the breast. If you are new to my channel, make sure to subscribe and turn on your post notification button so at any time I drop any video, you'll be sure to be notified. And if you want me to make a video for you, or you are reading a topic and you don't understand the topic, now send it down in the comment section. When I go to it, I will make sure I make that video for you and explain very well for you. So let us jump right into the video. So first of all, we'll start with the introduction of the mammary gland, or we can call it the breast. So anatomically, the mammary gland of the breast is a modified sweat organ. It is a modified sweat organ present in the superficial fascia of the pectoral region. Again, it is a modified sweat organ present in the superficial fascia of the pectoral region. It is present in both male and female, so you can find it in both sexes, but it is rudimentary in male, which means it is not functional, it is not developed. When it is developed in male, it is now a pathological case, and you can call it gynecomastia. But in female, at about puberty, after puberty, it becomes developed in female. And in female, it is an accessory sex organ in the female reproductive cycle, which attacks the site for production of milk used to feed newborn. Again, it is rudimentary in male, so it is not more functional in male, but it is present in male. The ducts are there, everything, but it is not developed due to the presence of testosterone. But in female, due to the presence of estrogen, the breast develops, and it is now a site for production of milk used to feed infants. Don't forget. So next is the location of the mammary gland of the breast. Where is it located anatomically? I know everybody knows where it is located, but just for your exams, you have to know some specific stuff about the location of the mammary gland. So one thing you have to know, like we said in the first slide, is located in the superficial fascia of the pectoral region. In the superficial fascia of the pectoral region. And when you know it's located there, also it has an extension. So the back of the breast, now the breast there, it has an elongated part called the axillary tail of spans. It has an elongated part in the superior lateral part, just in the posterior axis. So it has an elongated part called the axillary tail of spans. This axillary tail of spans is just like a pointed part in the posterior axis of the breast. So what happens? It pierces what we call the deep fascia of the pectoral region. It pierces the deep fascia of the pectoral region and enter into the axilla. So it has an extension, and that extension is called the axillary tail of spans, which pierces the deep fascia of the pectoral region to enter into the axilla. That part where it pierces in the deep fascia is called the foramen of Lange. So the foramen where the axillary tail of spans pierces is called the foramen of Lange to enter into the axilla. So the mammary gland of the breast is not just a conical structure or a hemispherical structure. It also has an extension called an axillary tail of spans. It's located in the superficial fascia of the pectoral region, and also it pierces to the foramen of Lange to enter into the axilla. And when you enter into the axilla, it is thought that that part in the foramen of Lange is a route where there can be spread of infection and also metastasis of cancerous cells at that foramen of Lange. So important anatomically, the foramen of Lange shows great importance because it can act as a route for the spread of infection and metastasis of cancerous cells. Don't forget it. So what shape is the mammary gland? So what shape is it? So it can either be conical, hemispherical, or a piriform shape. It can be any of these shapes, especially for your exam. Conical, hemispherical, and the piriform shapes. And it extends from where? It extends from the second rib to the sixth rib. Again, it extends from the second rib to the sixth rib vertically. In the horizontal axis, it begins from the sternum medially to the mid-axillary line laterally. So in the medial axis, it is bounded by the sternum. In the lateral axis, it is bounded by the mid-axillary line. While superiorly, it begins from the second rib. Inferiorly, it goes to the sixth rib. So second rib to the sixth rib, up and down, and medially the sternum, laterally the mid-axillary line. And the shape is either conical, hemispherical, or piriform shape. Don't forget it. Next is the relation to the mammary gland. So what is the relation of the mammary gland? Superiorly, it is bounded by the clavicle and the subclavius muscle superiorly. Inferiorly, it is bounded with the abdomen, which is the external oblique muscle inferiorly. So the subclavius muscle and the clavicle superiorly, this external oblique muscle inferiorly. Now in the medial portion, it is bounded by the P major, which is the pectoralis major. medially, and laterally is bounded with the what serratus what anterior. So subclavius and the clavicle superiorly, the external oblique muscle inferiorly, the P major, which is the pectoralis major, medially, and the serratus anterior laterally, and it is resting on the what the pectoral fascia. So it is resting on the pectoral what fascia, which is the deep muscle where the foramen of Lange is, where the axillary tail of sperm pierce the foramen Lange to enter into the axilla. So it's resting on the pectoral what fascia. Upper, it is related to the clavicle and the subclavius muscle. Lower is related to the external oblique muscle. Medially, the P major in the medial portion and also the sternum, and laterally the serratus anterior. Don't forget. So next is the structure of the mammary gland. The mammary gland has three basic structure. You have the skin, you have the stroma, and you have the parenchyma. The skin, the stroma, and the parenchyma. The skin basically contains two basic structures, which is the nipple and the areola. The nipple is a conical structure in the center of the breast, which is present in the fourth intercostal space. Now it contains smooth muscle fibers. It contains what? Smooth muscle fibers, which makes the nipple to be what? Erect, stiff, especially when it is what? Stimulated. Don't forget, for your exam you have to know that it's present in the fourth intercostal space, and it contains smooth muscle fibers, which makes it to be erect and was highly sensitive to touch. Don't forget. Next is the areola. The areola is a circular area of pigmented skin around the base of the nipple. I'll say it again. The areola is a circular area of pigmented skin around the base of the nipple. It has many sebaceous glands, so it's surrounded by sebaceous glands, especially in the outer margin, which help to secrete what sebum majorly, which is the oily part of the skin. So it secretes sebum, which what helps to nourish and prevent the nipple from what cracking. So it prevents the nipple and the areola from cracking basically. So again, it is basically important for you to know that it contains what sebaceous gland, and that sebaceous gland secretes what oil. That oil is very very important because it nourishes and it lubricates the nipple and the areola, preventing them from being dry and to what to crack. So basically the areola, I told you it is pigmented, so it differs from women. So women, if you are fair, the areola sometimes can become fair. If you are dark, the areola can become dark. So basically it's different for what different people, so different depending on the color and the race. Don't forget. So one thing you have to know for your exam, you should also know that during pregnancy the area around the areola becomes darkened, so it will become black and more pigmented. And also the sebaceous gland around the areola shows some small nodular elevation, and this small nodular elevation is called the Montgomery tubercle. So the Montgomery tubercle are small nodular elevations which appear when the sebaceous gland enlarges during pregnancy. And the same during pregnancy, what happens, the pigmented areola becomes toward darken. So the next time we'll be going into the stroma. So what is the stroma of the mammary gland? The stroma of the mammary gland contains dense connective tissue and fat. Again, it contains dense connective tissue and fat, which forms the supporting framework of the mammary gland or the breast. The first one is the dense connective tissue. The dense connective tissue are arranged in radial fashion, and this radial fashion, when they are arranged, they form what we call the suspensory ligament of Cowper. So the dense connective tissue comes together and form a fibrous septa, which forms the suspensory ligament of Cowper. And this suspensory ligament of Cowper attaches the skin and the duct of the breast to the pectoral fascia. So it connects the skin and the duct of the mammary gland to the pectoral fascia. Now this suspensory ligament is very important because it holds the breast and it makes the breast stand. So there's what we call standing, or make it protruded and to assume a horizontal firm shape, because you know that in old age the breast falls down due to the laxity of the suspensory ligament, or when a woman has had multiple births and multiple breastfeeding, what happens, the suspensory ligament becomes weakened and it falls down. So that the suspensory ligament of Cowper is very very important. Also the next one is the fat. The fibrofatty tissues forms the bulk of the breast, so it is scattered all around the breast except in the area of the nipple and the areola. So the fatty tissues are not present around the nipple and the areola, but it's scattered all around the breast and giving it its bulkiness or its fullness. So without the fatty tissue, what happens, the breast will not be full or bulky. So the fatty tissue is present there to give it that big shape, and the size enlarges due to the fat, while the suspensory ligament makes it protruded and standing. So for the sake of breastfeeding and to have a good appearance, because as you age, what happens, the suspensory ligament becomes laxy and begins to fall down. So hope you understand. Next is the parenchyma, or the glandular tissue of the breast. The parenchyma or the glandular tissue of the breast is the site for milk production in for what newborn. So the site for milk production in the breast for newborn is called the parenchyma or the glandular tissue. So we have talked about the skin, we have talked about the stroma, now we are in the parenchyma. So first of all, this starts by what 15 to 20 what lobes. The 15 to 20 lobes are arranged in radial fashion. They are arranged in radial fashion, then come together and open up in the what nipple. But first of all, we have 15 to 20 lobes. So those 15 to 20 lobes forms a cluster of acini called what lobules. So 15 to 20 lobes forms a cluster of acini to form lobules. Now these lobules are opened in a duct called the lactiferous duct. So we have lobules, we have lobes, and each of these lobes forms a cluster and open in the lactiferous duct. Now the lactiferous duct open in the lactiferous sinus. Again, we have 15 to 20 lobules. Lobules form a cluster of acini. Then the lobules now opens up in the what? In the lactiferous or duct. Then the lactiferous duct forms a long tube which later opens in the lactiferous sinus. Now the lactiferous sinus is located in the nipple, which is the reservoir where the milk comes out from the nipple. So again, you have the lobes, you have the lobules, you have the lactiferous duct, we have the lactiferous sinus, then we have the nipple. So the nipple is where the milk comes out from, but at an opening called the lactiferous sinus. So when it opens in the lactiferous sinus, then the baby then suck it out and come out as what? As milk, through a process called milk ejection reflex. But in the milk ejection reflex, there should be a contact or affection between the mother and the child, or a tactile stimulation of the baby on the breast before the milk can what? Come outside. Don't forget it. So the next is the blood supply to the breast. So what is the blood supply to the breast? So you don't forget the mnemonic PIA. Don't forget the mnemonic PIA. What is P? Posterior intercostal vessel. So you have the posterior intercostal artery and posterior intercostal vein. But now the posterior intercostal artery is a branch directly from the descending what? Aorta. You have I. I is the internal thoracic artery, or we call it the mammillary artery. So this is the main artery of the breast, and it is coming from the first part of the subclavian artery. The next one is A, which is the axillary vessel. So the axillary artery, which is a vessel which is arteries and vein, is coming directly as a continuation of the subclavian artery. So don't forget, we have PIA, posterior intercostal artery, you have the internal thoracic or the mammillary artery, and you have the axillary artery. So same thing you have for the vein. You have the posterior intercostal vein. So the posterior intercostal vein is draining directly to the azygous vein. Don't forget. Now you have I, internal thoracic vein. No, the internal thoracic vein drains directly to the subclavian vein. Don't forget. While A, you have the axillary vein. So the axillary vein drains directly. It continues with the subclavian vein. So we have PIA for arteries and vein. So the next is the nerve supply to the breast. The nerve supply to the breast is what we call somatosensory because it begins from the second to the sixth intercostal nerve. The second to the sixth intercostal nerve, which comes from the anterior and lateral cutaneous branches of the second to sixth intercostal nerve. So basically, it's supplied by a sensory and an autonomic. The sensory is directly to the skin. The sensory directly to the skin, while the autonomic is to the smooth muscle around the nipple. That's why I told you in the first time that the nipple has smooth muscles that when it is touched or a thin sense of touch, what happens? The sensory nervous system send an information. While the autonomic fibers, which is parasympathetic to the smooth muscle, which helps to contract the smooth muscle to release the milk, and you have to the blood vessel, which is sympathetic, so as to increase blood flow anytime there is tactile stimulation. So these two fibers are very, very important because sensory transmit to the nipple, which contract it and make it erect, which increase blood flow, and also these contractions is very important. Now the next is the lymphatic drainage of the breast. So one thing you have to know, the breast is divided into 4 quadrants. You have the upper medial, upper lateral quadrant, and you have the lower medial, lower lateral quadrant. So these 4 quadrants are very important quadrants in the lymphatic drainage of the breast. So one thing you have to know, the lymphatic drainage of the breast is divided into superficial and deep lymphatic drainage. Now the superficial lymphatic drainage drains everywhere around the skin. It drains all parts of the skin except from the nipple and the areola. That is the superficial lymphatic drainage. For the deep lymphatic drainage, they drain specifically the parenchyma, the skin, and the areola. Again, they drain particularly the parenchyma, the skin, and the areola. While the plexus beneath the areola is called the subareolar plexus of Sharpe. the subareolar plexus of Sharpie. So the deep lymphatic basically drains the skin, the areola, and the parenchyma. And the area below or beneath the areola is called the subareolar plexus of Sharpie. Now we also have lymphatic nodes all around this quadrant. We have lymphatic nodes all around this quadrant, and this lymphatic node mimic the same name as the artery. Why? Because they lie around the arteries or the vessels. You have to note that 75% of the lymphatic drainage goes to the axillary lymph nodes, while 20% goes to the internal thoracic or mammillary lymph nodes, while 5% goes to the posterior intercostal lymph nodes. Don't forget, 75, 20 and 5%. Don't forget. And in the axillary lymph node, you have to know that most of it drains to the anterior axillary lymph nodes, while the rest drains to the posterior and the apical lymph nodes. And from the anterior and posterior axillary lymph node, they drains into the central and lateral lymph nodes. And from the central and lateral lymph node, they drain to the supraclavicular lymph nodes. Don't forget. The relevant clinical case of the breast here is what we call the breast cancer or the carcinoma of the breast. In the carcinoma of the breast, it's usually the most prevalent cancer, mostly in women between the age of 40 to 60. And here there's cancerous cells, especially in the epithelial lining of the lactiferous duct. So it's more in the lactiferous ducts, present in female between the ages of 40 to 60. The next is the mammography or the self-regular breast examination. So regular self-breast examination is very good, at least once or twice in 2 months or 1 month, so to help you examine the breast and also help in early detection of any lump that can cause breast cancer with time. So the first thing you have to do, you have to go strip naked and open the clothes. And when you open the clothes, first of all, go in front of the mirror, examine the two breasts. So when you examine the two breasts, you examine whether there's nipple discharge. First one, examine whether there's nipple discharge, whether there's puckering or dampening of the skin, or whether there's change in color or change in the nipple size, or whether there's presence of lump or any physical changes you can see. The next thing you have to do is to put your hand behind your head and you have to lean forward. So the next is to put your hand around your hip. So you put your hand on your hip like the one you are seeing on the screen now, and you bow forward. So you put your hand around your hip and you bow forward. The second one is to put your hand around your head, like your two hands wrapped around your head, and you bow forward too. So the first one we talked about is to go in front of the mirror and check for changing contours, whether there's change in shape, or there's presence of lump, or there's puckering, or there's a lot of, when you sense any changes just physically when you go in the mirror. So the fourth one here we're talking about is that during shower happen, you raise one hand upward and you do you move your hand circularly around the breast to check whether there's unusual mass around the nipple and down to the other surface of the breast. You check for whether there's unusual masses or there's heavy painless mass that you notice around the breast and especially around the nipple. Then the fifth one is that what you do is that you squeeze the nipple. This one, maybe you are not showering, you squeeze the nipple for nipple discharge to check whether there's discharge, and you repeat it for the second breast. And the last, which is the sixth one, is that you repeat the stage 4 and stage 5 when you are lying down, because when you are lying down, the breast will be flattened, and when it is flat, it is easier to palpate any unusual mass there. When you palpate, it is quite easy to know, and as a sign of early detection for breast cancer. And when you feel the lump, you can go to your healthcare physician and report it, and this can save you from cutting the two breasts due to radical mastectomy, because radical mastectomy is usually used to remove one breast to prevent the spread of the cancer to other organs, which can kill the patient. So hope this all makes sense to you and you understand when we talk about the introduction to the breast, we talk about the location of the breast, we talk about the extent of the breast, the shape, and we talk about the structures of the breast. Hope you understand it from beginning to end. So if the video is too fast, maybe what you do is just to slow it down or to use the YouTube subtitle. So I hope you understand it, and if you want to understand it, you can also use your atlas, or this will also help you understand it very well. And if you are new to my channel, make sure to subscribe and turn on your post notification button, so I enter my drop any video, you're sure to be notified. So now always watch my video, always like, always share to every medical student that will need this video. I'll be seeing you in the next video now. Bye.